The latest National Family Health Survey or NFHS suggests that India has entered a new phase in child health. More children are surviving infancy than ever before. They are more likely to be vaccinated, born in institutions and registered at birth. The country's biggest challenge with children is no longer just keeping them alive. It is ensuring that they grow up healthy. So, in this video, we look at certain key indicators related to the nutritional status of children. But first, a word about the NFHS. It is conducted under the stewardship of the Ministry of Health and Family Welfare, Government of India, with the survey reports and datasets published by the International Institute for Population Sciences. If you would like to access clean, standardized and analysis-ready NFHS-related datasets, head to dataful.in and explore data across national, state and district levels, with historical survey rounds included for seamless comparison and trend analysis. And now, on to what the numbers say. According to NFHS 6, the share of Indian children aged 6 to 23 months who receive an adequate diet is 15.3%. In NFHS 5, this figure was 11%. In other words, despite a 36% relative improvement in 4 years, nearly 5 out of every 6 Indian toddlers still do not receive the diet considered minimally adequate for healthy growth. Having a low height for one's age is called stunting. Among children under 5 years, stunting declined substantially from 35.5% to 29.3% from NFHS 5 to NFHS 6. Being too thin for one's height is called severe wasting, and this also declined from 7.7% to 5.2%. Underweight prevalence in under 5 children registered a marginal decline from 32.1% to 31.8%. Even in NFHS 6, wasting remains almost 1/5 nationally, while stunting has declined much more sharply. This suggests that while long-term child growth is improving, many children continue to experience short episodes of illness, infection or inadequate feeding that interrupt healthy weight gain. Vaccination tells a very different story. The proportion of children aged 12 to 23 months who were fully immunized increased from 83.8% in NFHS 5 to 87.1% in NFHS 6. Most strikingly, over 96% of children had received at least one vaccine, and 95.6% received most vaccinations through public health facilities. As for exclusive breastfeeding under 6 months, which has followed a striking 3-decade trajectory, NFHS 6 marks the first major reversal. The prevalence increased from 46.4% in NFHS 3 to 54.9% in NFHS 4 and 63.7% in NFHS 5, reflecting sustained improvements in breastfeeding promotion and maternal counseling. NFHS 6, however, records a decline to 55.8%, erasing most of the gains made in the previous survey round. With that, we come to the end of this edition of Data Deep Dive. Head to the comments to share your thoughts on what these numbers indicate. Like and share this video and follow Dataful on all social platforms for more such data-driven, informative content.
Subscribe to our Dataful plan today and get access to our vast collection of cleaned, ready-to-use datasets across sectors.